Hello, everyone. Hello, everyone. Thank you for those of you who are joining. We see some old friends, some new friends. This is a good day. Thank you for tuning into the Popsicle Place Lunch and Learn. We will get started in a few minutes. We're going to give a couple more minutes for folks to join us. So thank you all for tuning in, sharing your lunch hour with us. That's the best gift ever. We're excited to share about our exciting programs we have to offer with our amazing partners. I see some of our partners are joining now. Thank you, partners. See some of our board joining. Thank you, boards, past board members. So nice to see some familiar faces. Thank you all. And I think you should be hearing audio at this point. Let's double check that. We want to make sure everybody can hear. Oh, great. Lots of people can hear. Awesome. Thank you. Thank you. Getting some support in chat there on how to toggle on within your Zoom account. So thank you for everybody helping out. Woohoo! We're going to get started in a couple minutes. We'll wait one more minute. We've got lots to share, full packed panel today. And then we want to give time for questions. So at any time during this, you have questions, you want to put those in chat. We're going to be excited to answer those, as many as we can. All right, we're getting good attendance. This is exciting. I think I'm just going to jump right in today and say hello, welcome. Thank you for joining us at our Lunch and Learn, where you're going to talk about Mary's Place and what we're doing with our Popsicle Place program alongside our partners that are here today. Really, we're working hard to address and prevent family homelessness with working with amazing healthcare providers through our Popsicle Place program, which serve families experiencing homelessness with medically fragile children. Right? What a tough topic to talk about, but we're grateful and thankful to be in this space and share with you today. I want to say, if you have any questions and you want to put them in chat today, please do that. Use the Q&A tab at the bottom of your screen, and we'll answer those at the end of the webinar. So let's see. I'd like to really just share with you that Mary's Place is really working to ensure no child sleeps outside by centering equity and opportunity for women and families in our community. And due to the cost of inflation, which we all know so much about, and the pandemic-related rental assistance and other supportive funds that have ended, and leaving thousands of families at risk of losing their homes. We are standing in that gap, and we continue really to see record numbers of family calling our intake line that are in need of shelter and services. And we know that losing your home is traumatic for any family, and it's especially difficult for families with medically fragile children. And so we're going to talk today about these families that have lost their jobs and housing and given up so much caring for their children who are undergoing chemo or dialysis and needing more surgeries or other life-saving care. And so today, our panelists are really going to share about Mary's Place Popsicle Place program and what it provides, because it provides that focused care and services for families experiencing homelessness with medically fragile children. And we're going to talk about how our mobile outreach team works with community partners to connect with families in hospitals with housing resources to make sure they have somewhere to go and aren't discharged into homelessness without home health care, right? But before I introduce our panel, I really want to take a minute to begin our time together by acknowledging the land on which Mary's Place operates. We are on the traditional home of the Coast Salish people. We offer gratitude to our elders and all other Coast Salish people, past and present and future, who have made it possible for us to live and work and love in this community. And we invite each of us to seek authentic relationships with Indigenous communities and to continue to learn about past and present colonial impacts and really to move beyond acknowledgement to action. I'm going to share a little bit more about Mary's Place too, for those of you that are new. Some of you are old friends and know a lot about us. I know that Barbara Campbell's joined, and I saw her yesterday. She's been a long time partner here at Mary's Place for 20 years, and others on the board. So thank you for joining. But for those of you that are new, Mary's Place began more than 20 years ago as a day center for women experiencing homelessness in downtown Seattle. We still have that drop-in center today, and it's still the heartbeat of Mary's Place. And we serve about 100 women a day at that day center, and we provide basic things like nourishing meals and resources for housing and employment and wellness and a sense of community and belonging for women who are needing that relationship and connection to each other. We opened our first overnight shelter for women and children in 2011, and we have continued really to develop our programming to address the growing needs in our community. And not long after that first shelter opened, we knew we needed to keep families together to address their housing needs together, right? So we opened a shelter that welcomed in dads so that they could stay with their families. And then we added extended families and families with pets and families who had lost everything caring for a sick child. And that was the beginning of our Popsicle Place program, which you'll hear more about shortly. And now today, we have 720 beds spread across King County in 5 shelters for families. And as you can guess, we've seen an unprecedented number of calls to our emergency family shelter intake line. And of about 35 calls a day, we are able to shelter just 1 or 2 families in this entire county. Sorry about that. And our staff are working hard, right, to really place those families that can't come into shelter. And that's where our mobile outreach team steps in, meeting families right where they are in their cars and their tents. And we connect them to the resources and the flexible funding that they need to address their barriers and move back into housing quickly. But we all know, it's not a secret, the safest and best place for a family to be is in their own home. And preventing families from falling into homelessness is so important to intervene, to stop that trauma, particularly among children, to end generational homelessness. So we invite you to look at some of our past lunch and learns and webinars and cover topics like housing services, our youth services programs, and the impact of systemic racism on homelessness and others. Katrina's going to share that link with you right there in chat right now. But now what you all been waiting for, I want to introduce this amazing panel to you. So let me get started. I want to introduce Nurse Tricia Nora. She is the healthcare coordinator for Mary's Place, which we're so thankful for her. We have Ryan Disch-Guzman, who is the Mary's Place Mobile Outreach and Diversion Director. Hello. And we are blessed to welcome Oriel Alfred, who is Mary's Place Popsicle Place Outreach Coordinator, working with our area hospitals and families. And we also have Shelly Jeng, who is a counselor for the substance use program for pregnant persons at Swedish Ballard. So I know you're all there, but you can give them a round of applause. I will too. So grateful, thankful that you're all here. I'm going to get started and I'm going to talk with Tricia. So Tricia, thank you for joining us. I want to say you've been here for a long time and almost since the beginning of Popsicle Place at Mary's Place. You've worked with hundreds of families with medically fragile children through the years. Can you share just a little bit more about the history and the origin of Popsicle Place and how it's evolved over the years to meet the needs in our community?
Sure, I'd be happy to. Thank you for the introduction. My name is Tricia Nora. I'm a pediatric nurse practitioner, and I've been with Mary's Place for about 6 years. When Mary's Place opened, our first family shelter, in Seattle, at the time, shelters were predominantly for just women or just men. They were not taking in the whole family. And so I was one of the first nurses at our family shelter up in the North End. As we opened our doors, we started to hear from our pediatric colleagues, specifically from Seattle Children's, that there were families who had medically fragile children, and these kids were being discharged from the hospital and they were unhoused. So they wanted to know how we could help. So working with our staff and our board and the Seattle Children's providers, Popsicle Place was created. Initially, we just had several rooms that were dedicated specifically for our Popsicle Place families. And those rooms had private bathrooms, they had access to refrigerators, so these families could take care of the children in this private space. Most of our guests at that time were on mats on the floor with a curtain pulled. So the access to a private room was very, very helpful. At this time, just to be clear, families are responsible for the healthcare of their child. So they are 100% responsible for the care, medications of the child. However, our healthcare team really acts as a liaison, and we support the family. We serve as a go-between with the providers at Children's. The families also, when they come into shelter, are also working on their housing goals. And again, the goal is to get them into their own housing. So in essence, we serve an unmet need in our community for these vulnerable, medically fragile children, for families experiencing homelessness. And as Marty said, it's really hard to understand or believe that these families could be discharged. They may have given up their job, lost their house to take care of their child, moved to Seattle for the care, but they truly are unhoused and being discharged from the hospital. In 2016, when we first started looking at our data, we helped about 10 families. That number has increased significantly, and I'll share those numbers with you a little bit later. To help illustrate the program, I think an example of a family who currently is a referral would be helpful. So right now, there's a 4-year-old girl who's at Children's Hospital. She has a rare leukemia. She and her mother moved from Alabama to Seattle Children's for a bone marrow transplant. The mother has 3 other children, and those kids are with an extended family member in California. So the family is separated so that she can get this care. The family can stay at Ronald McDonald House, which is a resource, and also the Children's Hospital has appointed some apartments that they can stay in. But at about 100 days post-transplant, this family will be unhoused. So they have reached out to us, and we are working with them to bring them in. Our goal would be to bring in the family, reunify the 3 children from California, and work on their housing needs. In pediatrics, we call this family-centered care because we're not just taking care of the child who's ill, but the entire family. We were very fortunate. As I said, we started with several rooms initially, and by 2020, we opened our regrade building that had an amazing setup of several floors of private rooms with bathrooms, with bathtubs for the first time, places to keep medications, refrigeration, and basically everything that we would want in a shelter was built for us. So it was perfect for Popsicle Place, and we were so grateful. However, at the same time, the pandemic started, and it caused a lot of challenges. We also reached out, and you're going to hear more from Shelly and Ryan, to a program that's called SUP, and that is Substance Using Pregnant Persons. So we expanded the program to help these persons as well. And again, you're going to hear more about that. We also started receiving referrals from the University of Washington and Swedish neonatal intensive care units. So these are units that take care of premature babies. I have another story to share of a mom who came through, and she had twins who were born 3 months premature. She had a history of alcoholism, and although she was doing very well, she did not have a place to go when she was discharged. Again, the social worker reached out to us through the coordinator, and you'll hear from Oriel. And then I speak to the social worker and get the history, understand what the children's needs are and what care is needed. And we want to be prepared to bring this family into shelter. These babies really needed to gain weight. They had nasogastric tubes placed, which means it's a tube in their nose and then it goes down into their stomach. This mom, if you can imagine, was experiencing homelessness, coming into shelter with 2 premature babies. Every 3 hours, she had to feed these babies by bottle, by mouth. What they didn't take, she then had to put through the tube. This took most, if not all, of her time, and it was certainly a challenge. Our healthcare team helped her as best as we could, but again, she was responsible for all these feedings. She did well for about the first week, and then unfortunately she came down with a viral flu-like illness. It was not COVID, but she essentially was experiencing vomiting and diarrhea. I came into work and she was really in bad shape. I called the front desk and asked Amanda, who's at our front desk, to come help me feed these babies. We gave the mom a trash can and some Pedialyte and quarantined her in, or isolated her in a bathroom and just said, you take care of yourself, we'll take care of the babies. So as a team, we made the bottles for the mom for the next 24 hours. We helped feed the babies, diaper the babies to try to get her through this viral illness. We knew that sending her to a doctor's appointment or to an ER would not be great for her. These babies were too fragile. She was too sick. And so we just needed to kind of get them through this rough patch. With our whole team, we were able to do this. The mom got better. And in less than 6 months, she moved to housing. The babies were thriving, gaining weight, really healthy, developmentally appropriate babies. So she was a great success story, but it also just showed how much our team really needed to come together to help her through this tough period. In 2022, we actually served 203 families. So from the inception of 10 families a year, we're up to 203 families, which is incredible. We truly appreciate the new space at Regrade, which allows us to serve the families in such a great way. And we appreciate your time and interest today in Popsicle Place. So now I'm going to turn it over to Ryan.
Yeah, I want to just step in a second and say thank you, Tricia. That is, I just appreciate hearing that history and really the examples of who we're able to help and support at Mary's Place in our shelter. But if you have questions for Tricia, please put those, use the Q&A tab at the bottom and put them in there, and we'll answer them at the end of our presentation. And so now I want to turn it over to Ryan. Ryan, you are leading our work with the mobile outreach team, and that has put you on the front lines of supporting families that are living unhoused and some who are managing complex medical issues and barriers. So we'd love it if you could talk about what the work your team is doing with partners and hospitals to meet the needs of families and how that work has evolved over time. So thank you, Ryan. Welcome.
Yeah, thanks, Marty. Thanks, Tricia. So I'm Ryan Disch-Guzman. I'm our outreach and diversion director here at Mary's Place, meaning I oversee our unsheltered programming. And about 3 years ago, 2020, which kind of coincided with the opening of the Regrade, we noticed the numbers of our families that we were serving in outreach. About a quarter of them had a child with a chronic illness or disability. And we wanted to get them indoors, get them into a safe space. And so, the timing with Regrade opening was perfect for us to work on piloting a role which we call the Popsicle Place coordinator role. And that role would intentionally work with hospitals and clinics throughout the county to make sure that when families discharge, like Tricia was explaining, that they go to a safe spot, that they either go to housing or they go to a shelter bed. And since we started this program, the program has been incredibly successful. Actually, our outcomes for our Popsicle Place coordinators are better than our general outreach program because they're so intentional in their work. Each coordinator is a senior specialist, meaning they've worked as an outreach specialist for a number of years and have that really awesome knowledge base. And you'll hear from Oriel just how brilliant she is and how professional she is in her work. And since then, we've developed really great partnerships to not only get families coordinated into shelter, but to get them coordinated into permanent housing. We just started a partnership with Bellwether Housing, Mercy Housing, and Seattle Children's Hospital with a project called Cedar Crossing. And it's a permanent housing location with case management attached to it, which is so rare in housing throughout the county. And Oriel and the other Popsicle Place coordinators are able to really coordinate families into that safe permanent housing. I can give you an example of like the type of families we serve. Because Seattle is, the Seattle hospital system is a regional hospital system, we get families from all over the Pacific Northwest. And I can remember one family who came from Montana. This was a single mom who was a manager at a Walmart had a really good, stable middle-class income, could afford a house in Montana, and she gets the horrible news that her child has a heart condition and she can only stay within 30 miles of Seattle Children's Hospital, which we all know is so incredibly unaffordable, and really difficult. And so she got referred to one of our Popsicle Place coordinators, worked with our Popsicle Place coordinator to get into permanent housing and get a unit that she could afford. And that's kind of the beautiful work that our team does. And as we've gone through this work, we realize there's a lot of gaps in our system. And one of the biggest ones is with pregnant individuals. A lot of people don't know this, but Mary's Place is the biggest provider for pregnant individuals that are experiencing unsheltered homelessness. And as we go into encampments, as we go into parking lots where folks are living unsheltered, we just have so many pregnant individuals, especially those with complex pregnancy, that we're not getting the support that they needed. And so that's when we expanded our Popsicle Place coordination. And like Tricia was mentioning, we expanded our shelter programming to really accommodate these folks. And I'm really proud that we've done that, because we really intentionally want to make sure that those who are pregnant have healthy outcomes. That we want to prevent things like miscarriages. We want to prevent things like maternal death. We want to have solutions toward that. And a big solution towards that is making sure that people are healthy, and that folks are getting the housing that they need. And Shelly's program with SUP is so essential to that. And our work with them is to make sure that those with complex pregnancy, those who are pregnant and struggling with substance use disorder, have safe places to get treatment and then to get housing with our team. And it's been an amazing partnership. And I can give you an idea by mentioning one story of a family that we encountered, that we met this one couple and they had just found out that they were pregnant, and they've been struggling with substance use disorder, with opioids for a few years. And them getting pregnant really changed their mindset for them and said, we both want to get clean. We want to go into treatment. We want to and we want to be good parents for this child that we're about to have. And we were able to coordinate with the SUP program. We were able to get treatment for the father. And they both went into treatment at the same time, ended up coordinating into long-term outpatient treatment. Were housed, have been sober and healthy since that point, and in stable housing with their beautiful child. So I think it highlights the importance of this work and giving people new healthy starts, and hearing outcomes like that. I think that's why we all do the work that we do. So I'll let you hear from Oriel to hear her great work. Or sorry, Shelly. Shelly's next. Sorry, Shelly's work. You'll Shelly, and then you're Oriel.
Yeah.
You got it, buddy.
We've got them both. Yeah, Brian, just thank you. Thank you for your work, for your passion, your commitment, your dedication to your team, to our community, to these families. It is a real gift. If you have questions for Ryan, you know where to go. The Q&A tab at the bottom. Please put those in there. We want to make sure we get to those questions right after our presentation. And as Ryan reminded us, we have two amazing partners left in this work and on this panel. So we're going to turn it over to the amazing Shelly. So thank you, Shelly, for being with us today. We know that partnerships with healthcare providers like Swedish Ballard have been critically important for being able to meet the needs of families, right? Ensuring that they're not discharged from hospitals into homelessness. So Shelly, we would love it if you could share more about your work with the patients and how you connect pregnant people and families with Mary's Place.
Thank you so much. Yeah, we are so grateful for the connection we have with Mary's Place. Our SUP program is, we take pregnant people up to 36 weeks pregnant, and they're really fearful before they come in of asking for that help, especially when they're out on the streets and they haven't had medical care. And they come into us and we meet them exactly where they're at. We ask them what they need. We provide trauma-informed care. We complete an individual service plan, having them work on this at the very beginning till they complete. Most have little or no income because they are off the streets. Most are homeless or about to lose the place that they're in. We send referrals to Mary Place at the get-go via internet, and then email. Then I usually email Oriel or Kiana, and then they call our patients and get going with them and help them to get the housing that they need. They will help them with Oxford housing, or if there's an opening at the shelter. A lot of times when they have pets, they're so afraid to go anywhere, and that's where Mary's Place has that wonderful option of going there with their pet, or their significant other or their partner. Without a place that's stable for patients, they'll go right back out on the street, and they won't be able to take care of their kids, and they'll end up relapsing, and they'll lose their children to CPS. Our program is for pregnant women. We have two different sides, and one is the SUP side, and then the other is the detox side. Currently, we're taking up to 12 people at this time. We've kind of decreased the amount of people that have come in. On our detox side, we do take 3 people that are not pregnant, so they have the ability, but that just depends on the demand. Mary's Place, we have resources such as Mary's Place. We have PCAP, First Clinic, Institute for Black Justice, TANF, WIC. We have options for them to go to 6-month or IOP and medication assistant treatment, or Oxford housing, which Mary's Place steps in and will help for a few months of that for them, which Oxford housing is, there's housing for pregnant people who can go there, or women and children, which is pretty awesome. And it's all like a sober environment for them. We also integrate communication with DCYF, CPS, and I just want to say, without the help of Mary's Place, the people that we work with have a greater chance to stay sober and succeed. We also want to say thank you for Mary's Place, everybody that I work with. They know that I'm being able to do this, and they're very grateful for us to have that opportunity to let you guys know. Thank you so much. And
Shelly, you are so great, and you're such an incredible partner for us. And we just want to thank you and Swedish Ballard for all of the work you do working on the front lines with our pregnant persons. So we're so, so grateful for you. And as you've all listened, you probably have questions for Shelly. So please use the Q&A tab at the bottom of your screen and put those in, because we want to make sure to answer those as well. It's a dynamic program, and we want to make sure to answer all those questions that you might have. And now, to wrap up our panel, we have the awesome Oriel. Oriel, your work at Mary's Place as the Popsicle Place outreach coordinator really puts you on the front lines. You're out front working every day with families who have children dealing with complex medical issues, who are experiencing or at high risk of experiencing homelessness. So we'd love it if you could talk about your work and share how the patients really get connected with Mary's Place services and how you work together with them to find that housing that they're so desperately searching for. Take it away, Oriel.
Thank you, Marty. Hi, I'm Oriel, one of the Popsicle Place coordinators. So the initial point of contact with me is like 24 to 48 hours. We will make contact with with our clients. Sorry, my camera's messed up. At that time, we will then reach out to the family. I will go in and, or one of us will call the family back. We'll do an housing assessment. We may have more information. So if it's a Popsicle family coming from Children's Hospital, it's like 24 to 48 hours. In that 24 to 48 hours, I'll have some questions, whether they're needing to go to shelter, whether they need to go to, whether they have a place that they're going to be going to stay at. We assist with anything to take care of that family. For one of our subs moms, I would then contact the Swedish hospital when I make contact with Swedish Hospital, I'll then do a housing assessment with the client, and then we'll assess what's best for that family. At that time, I want to say this, whatever's going on with the family, we meet them where they're at. So if we need to reach out, go to the hospital, we go to the hospital. If they need to come to us, they come to us. If they have the ability to come to us, they will come to us. However we can. Once they get into their place, we do assist with toiletries, furniture, if that's needed, household items, say they need blankets, stuff for their children, we assess any way we can. If it is a family that is like, I guess I'll give an example. For a family that is like is coming into Mary's Place, and they are now going to be working with me, and they have some type of issues as far as like they fled from out of state and they're now here. We would go talk to the intake line 2 days before the family is scheduled to be here, try to see if we can get some leadway on that, on getting them into some type of shelter, whether it's shelter or connected to another shelter that best fits their needs. I think Ryan and Shelly and Tricia kind of summed it up as far as like everything that is, everything that I do. If you have any questions, I'm willing to answer them.
Oriel, thank you so much for sharing. Thank you for being on the front lines, for being with these families, coming alongside and offering those resources and supports. It's an incredible gift to have you on our team, and we are so grateful for you. And as Oriel said, please use the Q&A to put in questions for her. We're happy to answer any of those questions, but I'd like to do a big drum roll and thank the panel for being here and sharing your expertise and the incredible work that you do in this community together with our families. So Katrina, do you want to share some questions that we have? That would be nice to hear those. And then panel, just jump in if you know the answers, and we'll get those answers coming to you.
Yeah, thank you, Marty. We have some great questions that have come in so far. The first question is someone's interested in, they'd love to hear about how early support services, meaning birth to the age of 3, can support these families while they are at the shelter. Early support agencies can offer services at Mary's Place and follow the families when they move to permanent housing potentially, and would just like to hear about what might be offered currently.
Sure. Do any of the panelists want to take that?
I can speak just like the outreach side, Marty. I know this question was specific to
For
shelter. But
yeah,
I can
answer for
I can speak to the outreach side.
I can help too.
Yeah, but on the outreach team, we work alongside one of our partners, Navos, and what they've done is we've worked with them on a project where our entire outreach team, all of our outreach specialists, Popsicle Place coordinators, are trained on 2 different developmental assessments. One's called the Ages and Stages and Questionnaire, another one's a Pearson sensory assessment, and they're self-assessments that families can do with their child. And so we want to really support the developmental health of children, knowing that going through unsheltered homelessness is a traumatic situation. And so we want families to be able to easily access the resources needed to heal once they're in housing. And so we've been working really intentionally on that. Navos is going to be running what they call an attachment vitamins group, which is a parenting group to help families with that process as well. So we're trying to be really intentional in outreach with these families that we're connecting with around early development.
Thanks, Ryan. Tricia, did you want to add that from a shelter perspective?
Sure, I'd be happy to. So when our families come into shelter, one of our primary goals is to connect them with pediatricians or primary care doctors. So as a pediatric nurse practitioner, I'm not their primary care doctor. I am, again, just this liaison connection. So with each family that comes in, our goal is to meet them within 2 weeks. and connect them to primary care. I'm at regrade, so public health is an amazing resource. We do have 5 other shelters, so each of our healthcare team will utilize the resources in their vicinity. We also work with Boyer Clinic, and then along with our youth services team, is another team within our program, they're going to see the kids at our kids club and help to assess if they think there's a developmental disability, a developmental delay, a speech delay. And then again, we're going to try to make that referral. So the main thing is to get them connected to a primary care doctor who can actually do that assessment and see the kid. And then the second thing is to assess while we're in clinic or while we're in shelter to see if they need any specialty clinic. We now have, because we're post-COVID, have Boyer children's actually coming in, some occupational therapists and some physical therapists actually do home visits, and they will come to shelter, which is very helpful because it is difficult for our families to sometimes get to these appointments with other children and transportation and many other barriers. I hope that answered the question, but if it didn't, please let us know.
Yeah, thank you so much, Ryan and Tricia. Next question, I think Marty would be great if you would want to answer.
Sure.
Wondering where the name Popsicle Place came from.
Oh, yeah, that we should have loved with that. That is a great question. Popsicle Place. When we were really working hard on developing this program, we had 2 board members, JJ McKay and Dr. Brian Carton, who is a Seattle children's physician, that were working together with us to formulate what this could be. And I think it was Dr. Brian that came up and said, and when we were trying to think of a name, Dr. Brian said, you know, every child in the hospital loves a sweet treat of popsicles. So maybe we should think about this being a sweet place to go, and maybe Popsicle Place. So that's kind of how it was born. The name was born for the program.
Great, thank you, Marty. Next question is, if the medically fragile children temporarily have to go back to the hospital, whether it's planned or unplanned, can the family keep their spot at Popsicle Place?
Nurse Tricia, do you want to answer?
Yes, I'm happy to. That is a great question. Yes, they can. So if the family needs to return, they go to the ER, perhaps the child's readmitted, they do not lose their space. We just ask them to be in communication with us about the status. If the child needs to be in the hospital for a week or 2 weeks, they absolutely keep their space. Yes.
Great, thank you. What is the typical availability for the Popsicle Place program? I think the question might be geared towards space and shelter and capacity. Is there a wait list, an expected wait time?
I can try to answer that as well. So if the family actually needs to come into shelter, we do our best to provide the room, and the bigger heads up we have. I know Oriel said 24 to 48 hours, but we love even more time to plan. Right now, I can tell you our Popsicle Place rooms are filled. So we do our best to accommodate these families. And if we can move people around out of a private room down to the second floor that has a curtain, we will. But there are times when actually we are full. We do have the capacity to use other shelters besides Regrade. That seems to be the primary place, but we have a Burien shelter and Bellevue. So we try to exhaust all possible options. But yes, there are times when we do not have the ability to bring them into shelter. And then we would keep their name, the intake would be aware, and if we can make a move, or if someone would get housing and move out, then we would try to bring that family in as soon as possible.
I'll just extend upon that too. Like, we're a housing first model as well. So when they get to a Popsicle Place coordinator, we are always looking for that permanent housing first. And about 80% of the time, coordinators like Oriel are getting these Popsicle Place families into housing. And then that's because we only have limited beds, like what Tricia is saying. And we want to make sure that we keep those beds as free as possible. And an essential part of that is making sure that we are doing our best to get families into housing, at discharge, when that happens, we want them going into housing, like Shelly was kind of talking about, a place like Oxford House, where it's like safe for them to land and they can get the supports that they need, or a place like Cedar Crossing, which is permanent housing with case management attached to it to really get those supports in there. So our model is really housing first. And I think, we talk a lot about shelter, and I think people know us for shelter, but I think, Marty will say this as well. We want to be housing first, and that's our goal.
Thank you both. This next question, you actually, Tricia, touched already just a little bit on it, but wondering if you or others want to expand. Can kids get home health services at Popsicle Place, like PT, OT, home nurse visits, etc.?
Yes, I'm happy to answer that. During COVID, we were challenged by those not being able to enter the building. So that was difficult. But now, yes, they can absolutely come in. So if a child needs, and again, Boyer Clinic is offering us home care by assessing and seeing our kids weekly or twice a month in our clinic. So yes, they can.
Thank you. And right now, I think just a couple questions left so far. So if you do have other questions, please do feel free to put them into the chat. We certainly do have the time. The next question is, how do pregnant women experiencing homelessness and families hear about Mary's Place, or about these, not just Mary's Place, but these programs in general, the supportive programs?
Yeah, I think you can answer that question. For most of the time, when they're connecting with outreach, it's coming from, so Popsicle Place in general, a lot of our referrals just come from hospitals and clinics across the region, and coordinators like Oriel are really developing intentional relationships around those to create those partnerships. And when it comes to pregnant individuals, our biggest referrals come from the SELF program, and they also come from ETS Reach, which is the main outreach arm of KCRHA and the city of Seattle. And they're the ones that are working there. If you see people in jackets, they're the ones who are at encampments. Those are them, and they know that we serve pregnant individuals, and they will connect us really rapidly with them. I think another thing, though, I just want to stress is, like, this group that attends these lunch and learns, you all are like our voice in the community. And I think something for you all that you can help us out with is just making it really aware in the community that we do serve pregnant individuals, and we do serve to get them into housing and to get them into shelter and get them the supports that are desperately needed. And so if you know of families that are needing that support, don't hesitate to reach out to our outreach portal or our intake line to let families know that we are here to assist and help. So if I have one ask of you, it's to get that word out and to make sure that families are aware of us.
And I just want to also add that as soon as they enter our program, we are giving them Mary's Place information right at the get-go, and all of the resources that we have available. And they are so grateful. We get letters from the patients saying how grateful they are. So we really try to get that out in the community. And I think, they actually come in, the people actually come in and say, oh, I heard about this from so-and-so. So word of mouth too, after they come to us, they get out there and they can talk about Mary's Place as well. So it's kind of cool how it's done.
Thanks so much, Shelly and Ryan. Next question, are there plans to expand Popsicle Place dedicated beds and rooms at other shelter sites, such as the Bellevue site, for example, in order to meet the need?
I can jump in there. Hi, Lauren. Thank you for asking the question. Mary's Place, for those of you who don't know, operates the King County Family Shelter intake line, 8 a.m. to 11:30 p.m., 7 days a week, 365 days a year, taking all of the phone calls. And we'll put that phone number in the chat so that you have that, and we'll add it out as a link when we respond back, so that you know that number in case you ever see a family, and our portal to our website where you can refer families. But on that, when families call that, we do an assessment, and we really have to determine who are the most vulnerable sleeping outside because we don't have enough beds. And medically fragile children is one of the three categories: medically fragile children, families fleeing domestic violence, and of course, children 0 to 2 and pregnant women are the ones that we prioritize in this county as the most vulnerable sleeping outside, because the most lifelong trauma will happen to those children. And so what we do is they're first and foremost on the list. But if we don't have room, as Nurse Tricia alluded to, then at the regrade, then we do use our Burien and Bellevue sites. And we also, they're on the list for other providers. We have 6 other providers we work with. So really, they are prioritized for any available bed in the community. So that's our goal. Yeah, we need more beds, is absolutely right. But that's what we're doing now to mitigate the crisis outside.
Great, thank you, Marty. A question about more of our kind of volunteer programming and opportunities. Are there volunteer opportunities around the Popsicle Place program specifically?
I can try to answer that. Not specifically, and I would say the building opened in 2020, right when COVID happened. We are now really having robust conversations with our volunteer coordinators about who can come in. So I'd say we are interested in anyone who might be able to help us. And there's one comment in the chat about someone who wants to come in and maybe be a mother's helper. And that was something we started right before COVID, where these moms can't leave the building without their children. So if someone could hold a baby while mom takes a shower, or do laundry, or let her speak to her housing advocate, or even to the healthcare provider without 3 children, other children around, that would be fantastic. So we are open to those ideas. And we have 2 volunteer coordinators who would speak to the healthcare team to say what would work, or how could we make this happen. But we're certainly open to the idea. And the time is right now to bring people back in. But Marty, do you want to add to that?
Sure. Yeah. As we are formulating those ideas, and we'll definitely shout those out, those volunteer opportunities, but there's always the opportunity from home or with your neighbors. One of the things these new moms are needing to are, you have to remember they've left with really mostly only everything they can carry on their back. So they've left a lot of things behind. So we always have a needs list on our website, an Amazon kind of charity wish list, which talks about our, shares the need for diapers, pack and plays. We have, and not only new, but gently used things are on there as well. Putting together diaper bags, because we love baby showers, right? And we have lots of baby showers as babies are being born, with our pregnant moms that come in and deliver and bring their babies back. But there's so many other ways and opportunities of things that you can collect to help our families and these children. And, you think about the coloring books are the things that they have while they're in the hospital. And then once they leave, they don't necessarily have all those toys or games or Legos or things they can play with in their room. So there's lots of opportunities and ways we can get connected, but you can get connected at volunteer@marysplaceseattle.org. And so you can see that on our website, and Katrina will share those links as well. So lots of ways to engage, because we need all the help and support for these families. And the greatest gift is our neighbors coming beside each other to help and support one another. So thank you for asking that question. I do see what were the hours of the intake line: 8 a.m. to 11:30 p.m. at night, 7 days a week.
Perfect. Thanks, Marty. And I was just going to add to we had a couple kind of questions that were more related maybe to the intake line. One question I think was more in reference to when you opened, sharing about how many families call into the intake line versus how much may be told there is actually space. And if you could just share some of that information again.
Yeah, just, in the last month and through time, the numbers have been escalating, right? And there is a flood of families lapsing into homelessness as evictions take place predominantly. And so what we're seeing is about 35 to 40 callers a day. There's about many times over 100 calls a day. Some people are looking for rental assistance and other resources and all of those things. But of those that qualify, which are unsheltered families, are who we put on the list every day. And so 35 to 40, and lately it's been 1 to 2, can be up to 3 or 4 that might get shelter, just depending on how many folks are moving out of shelter into housing on that given day. And that's all across the county. Yeah, it is. We are in desperate times. We have more people, more children sleeping outside ever before than in our history of collecting this data.
Thanks so much, Marty. And I think that's all the questions that I can see. If I missed any, please do send a ping that we can answer. Otherwise, we can certainly, I will be following up with an email to everybody afterwards, so you can contact me directly. If you think of any other questions or want to connect and engage in any other way, we can be sure to do that. But since we have a few minutes, just wanted to give the time if any other panelists had anything they wanted to share.
Well, I think we all want to thank our panelists. Thank you for sharing your wisdom and your insight today. And thank all of you for joining and tuning in. You know the crisis outside, and you know ways you can advocate now and help support our Popsicle Place family. So thank you for that. And we hope you found this discussion helpful, right? And understand some more of the complex barriers these families are facing. And so if you have additional questions, like Katrina said, don't hesitate to reach out to someone on our team. And there are several ways you can support Mary's Place, right? We want to, and our partners like Swedish Ballard in our efforts to ensure that no child sleeps outside. One of those is on May 17th, if you haven't heard already, our Dream Big Luncheon. We want y'all to come have lunch with us at the Seattle Center, May 17th from 11:30 to 1 p.m. We'll put a link there in chat too, and you can join and sign up right now and bring friends, right? There's no cost to come, but we will have an ask at the event, and we just hope that you can come. And that's one way to show your support for these families. And just a big thanks to Shelly for joining us today. And we will be able to send you some links and resources for how you can support our partners at Swedish Ballard. But most importantly, thank you for being you. Thank you for loving us all so well. And we'll be doing more Lunch and Learns events, and you'll get updates on those. But also, you'll see a little survey pop up in your browser right after you exit this. So we hope you'll take a few minutes. We really want to know how to do this better, how to make sure that you're getting the information in a way that's helpful to you. So if you could please do that, and then share ideas for other topics that you'd like to learn more about. Thank you, really, for being the grace and goodness of this community, for loving your neighbors, for seeing them, and coming alongside. It's the greatest gift. And so we are grateful for each one of you. Please enjoy this wet spring day, but know that we are here thanking you and grateful for all that you've done for all of us. Big thanks, and have a great rest of your day. Bye, everyone.